Nurse Staffing by Amber Beaumont, RN, Shanna Carrillo, RN, Nikki Holliday, RN, and myself, Rachel Lumbert, RN. Defining nurse staffing. The nurse-to-patient ratio is the ratio of nurses on a particular floor, ward, or unit to the number of patients. The greater the anticipated acuity of care, as in the ICU, the lower is the ratio in a high-quality healthcare facility. 1 nurse to 6 patients is the normal ratio in a medical surgical unit, 1 nurse to 2 patients in an ICU. Safe staffing, as defined by a federal regulation, mandates that hospitals must have adequate numbers of licensed registered nurses, licensed practical or vocational nurses, and other personnel to provide nursing care to all patients as needed. What we know and what history shows. Hospitals seek to cut costs by eliminating registered nurse positions. In doing so, nursing care is overloaded, causing a decrease in quality patient care. This causes nursing retention to decrease while patient readmission rates increase. ANA, or American Nurses Association, reports that one study showed the likelihood of overall patient mortality, or in-hospital death, and mortality followed a complication increases by 7% for each additional patient added to the average registered nurse workload. ANA informs us that inadequate registered nurse staffing results in poor outcomes. Patients are at risk for longer hospital stays, injuries, medication errors, falls, increased infections, and even death. ANA established the Registered Nurse Safe Staffing Act in 2015. This act would pertain to facilities abiding by Centers for Medicare and Medicaid Services. A group of nursing professionals are established to ensure patient safety, reduce admissions, and improve nurse retention. 7 states utilize this act: Oregon, Texas, Illinois, Connecticut, Ohio, Washington, and Nevada. This act was put into place to protect nurses. The Health and Human Services will impose civil monetary penalties for each known violation, and staffing information is required to be publicly displayed. Leadership and management aspects. Management styles of the health organization play a vital role in promoting workplace empowerment, organizational commitment, and job satisfaction amongst nurses in management positions at hospital settings. Behavior and organizational research on work and workforce effectiveness, health services research, studies of organizational disasters and their evolution, and studies of high reliability organizations have identified management practices that are consistently associated with successful implementation of change initiatives and achievement of safety in spite of high risk for error. These practices include balancing the tension between production efficiency and reliability or safety, creating and sustaining trust throughout the organization, actively managing the process of change, involving workers in decision-making pertaining to work design and flow, and using knowledge management practices to establish the organization as a learning organization. Future trends. Shortages offer opportunity. According to a 2013 survey conducted by the National Council of State Boards of Nursing and the Forum of State Nursing Workforce Centers, 55% of the RN workforce is over the age of 50 or older. Employment of registered nurses is projected to grow by as much as 16% by 2024. This means potential wage increases, mandatory overtime, and increased contract work for current nurses in the meantime of excessive patient ratios. There will be an increasing number of patients. As a high percentage of baby boomers reach retirement age, their need for healthcare will grow and intensify. There will be increasing job duties, as nurses are going to play a large role in making sure patients take care of themselves as they are released from the hospital or another healthcare facility. As nurses are in short supply and patients are not, an increase in basic job duties is inevitable. This will most likely cause quicker burnout and decreased job satisfaction. Suggestions. It would be prudent for nurse managers to recognize the influx of patients and begin to hire more nurses immediately, rather than waiting on critical staffing ratios to appear, as that is unsafe for patient care. Nurses must also join together and make their voices heard to protect both themselves and patients from harm. Summary. In conclusion, significant efforts have been made to deal with nurse staffing problems for decades. However, the current practices are not effective enough. This is due to the uneven and constantly changing aspects in the nurse-to-patient ratio. Possibly the most critical factor that nurse managers should consider is whether their staffing technique facilitates safe and effective care rather than simply fitting the budget. Thank you.